Hello everyone, my name is Sarah Shrita, and today, with my colleagues Amal Bitar, Mariam Khan, and Cindy Lee, we'll be presenting sleep and improving sleep habits. So what are some theories of sleep? The first one is brain plasticity. So sleeping, especially during REM stage of sleep, reinforces learning and memory, while at the same time helps us forget or to clear stores of unneeded memories. Another theory is energy conservation, so it reduces the individual's energy demand, and is why our metabolism is usually slow during sleep. Emotional discharge, so researchers believe that REM sleep and dreaming can provide an outlet for emotions and stress. Inactivity, or the adaptive theory, it serves as a survival mechanism to keep organisms out of harm's way. And finally, restoration theory. So it repairs and rejuvenates the body, such as muscle growth, tissue repair, growth hormone, and more. So how much sleep do we need? According to the American Academy of Sleep Medicine and the Sleep Research Society, they recommend roughly 16 hours for infants, 13 to 14 hours for children ages 1 to 5, roughly 10 to 12 hours for children that are 6 to 18, and then 7 hours or more for adults 18 and on. There's 4 stages of sleep. The first 3 are considered non-REM, and the last stage is REM. So for the first stage, it's also called the dozed off stage, where the person is easy to arouse, and this stage includes eye rolling, relaxed muscles with some twitches. The second stage, we have decreased temperature, muscle tonicity, breathing, and heart rate. The eye movements will stop, and we'll have slowed brain activity with some bursts of activity that helps resist arousal from external stimuli. The third stage, experts believe that this stage is crucial for restorative sleep, which allows for our body to recover and grow. The fourth stage, which is the REM stage, it stands for rapid eye movement. The body muscles will have temporary paralysis, yet the eyes and the brain will have increased activity as if the person is awake. This stage is crucial for cognitive functions such as memory, learning, and creativity. Circadian rhythm is the body's internal clock. It occurs in plants, animals, fungi, and bacteria. It can be affected by external cues like temperature, light, exercise, but it does not respond to new time zones such as jet lag. There is data that supports sleep affecting metabolism and weight through regulation of cholesterol and glucose. So the study looked at the effect of sleep and obesity, physical inactivity, and current smoking, and alcohol use. So they compared patients that slept for less than 7 hours and then patients that slept for 7 and more hours. And they found that patients that slept for less than 7 hours had a higher risk of obesity, physical inactivity, being a smoker. But when they looked at alcohol use, there was not any significant data to support that people who sleep less will become alcoholics or will use alcohol excessively. So some sleep disorders are narcolepsy, which is excessive uncontrolled daytime sleepiness. And one fact about this is that this disorder only has one pharmacy that dispenses the according medication to treat it. A second disorder is restless leg syndrome, which is irresistible urge to move legs, typically occurring in the evening or nighttime, and a lot of pregnant women experience this disorder. Obstructive sleep apnea is partial or complete airway obstruction with no or little breathing, and this occurs in 16% of the US population. And then finally, insomnia, which we will focus about, happens in 20% of the US population, and it is persistent trouble falling and staying asleep. And from the 20%, 7% of students experience this. So looking at how insomnia is classified, it's defined as one or more of the following. which are inability to initiate sleep, inability to maintain sleep, or early morning awakenings. It also will occur for 3 or more nights per week for 3 or more months.
I will be talking about risk factors causing insomnia. The first risk factor is gender, as women tend to have a higher risk for insomnia than men. This can be because the hormone shifts that women experience during menstrual cycles, menopause, and pregnancy play a huge role in insomnia. A second risk factor is age. As sleep duration and quality deteriorates with age, this can be because the body processes circadian signals less efficiently as we grow older. Polysomnographic studies have shown that elderly people experience lower percentage of both slow wave and rapid eye movement sleep and rapid eye movement sleep than their younger counterparts. This leaves them more susceptible to waking episodes during the night and reduced quality of sleep. Another factor is physical health. Any compromise to physical health will in turn compromise quality and ability to sleep. These are some examples of medical conditions that may cause insomnia. First one is diabetes. Because of the peripheral neuropathy, constant need of hydration and urination, and rapid blood sugar changes that can impair the ability to sleep. Cancer, because of the chronic pain the cancer patients experience, can interfere with the ability to sleep and may cause insomnia. Pulmonary diseases, over 75% of individuals with COPD report nighttime symptoms and difficulty sleeping. And this is because breathing becomes more difficult when they lay down. Hyperthyroidism, because of the constant arousal caused by nervousness, irritability, night sweats, and frequent urges to urinate. Thyroid diseases may also be a predisposing factor to restless leg syndrome, which is an unpleasant or uncomfortable sensations in the legs while the body is at rest, which can impair sleep quality and increase nighttime awakenings, which can also cause insomnia. As for mental health disorders, it is estimated that 40% of people with insomnia have mental health disorders. And those disorders include, but not restricted to, depression, anxiety, and bipolar disorder. These conditions can lead to pervasive negative thoughts and mental hyperarousal that disturbs sleep. Studies show that sleep deprivation or insomnia can exacerbate mood and anxiety disorders, making symptoms worse and even increasing the risk of suicides, creating a vicious cycle between insomnia and mental health disorders. As for stress, it can come from work, from school, and social relationships. Exposure to traumatic situations can create chronic stress, including PTSD or post-traumatic stress disorders. The body's physical response to stress contributes to hyperarousal, reduced quality of sleep, and mental stress. And the same cycle that we saw between insomnia and mental health disorders also applies to stress and insomnia. Regular sleep schedules and lifestyle are also risk factors for insomnia. Irregular sleep schedules can disturb and misalign the circadian rhythm. For example, shift changes at work that require a person to work through the night and sleep during the day. And traveling or jet lag. Jet lag disturbs sleep because a person's body cannot adjust to a rapid change in time zone. As for the lifestyle, electronic devices can keep your brain stimulated until late at night and prevents you from sleeping. Napping late in the afternoon can also interfere with the ability to sleep. Also, making up for lost sleep, which is mostly common among students and people who work night shifts. Using the bed for activities besides sleep can create a mental association between the bed and wakefulness. Caffeine, which is a stimulant, can stay in your body for hours and prevent you from sleeping at night. Alcohol, which is a sedative and can make you feel sleepy, but it can actually worsen your sleep by disturbing your sleep cycle and causing fragmented, non-restorative sleep. The last risk factor is medications. Many medications can interfere with the ability and quality to sleep and may cause insomnia. Some of the most common medication classes to cause insomnia are SSRIs, antidepressants like fluoxetine, stimulants like methylphenidate, nasal and oral decongestants like pseudoephedrine, corticosteroids like methylprednisolone, and blood pressure medications like beta blockers, ACE inhibitors, and angiotensin receptor blockers. Statins for cholesterol like atorvastatin, cholinesterase inhibitors like donepezil, which is used to treat dementia, theophylline, which is similar to caffeine and is used to treat asthma, thyroid hormone replacement like levothyroxine, and nicotine replacement medications like Nicoderm.
Practicing good sleep hygiene is one of the most important aspects for better sleep. This encompasses setting up a sleep-inducing environment, engaging in daily healthy habits, and optimizing your sleep routine. Your bedroom should be set at a cool yet comfortable temperature. Most doctors recommend keeping the thermostat between 60 to 67 degrees Fahrenheit, as warmer temperatures can cause discomfort and restlessness. Keep your bedroom quiet and dim, as bright light can hinder the production of melatonin. Some people may play white noise such as rain sounds to help maintain sound consistency and mask the perception of another sound that is more intense. Calming scents such as lavender can also help induce relaxation. It is important to practice good daytime habits for sleep and overall health as well. This includes maintaining physical activity and a healthy diet. Spending time outdoors in the sun can help synchronize your body's circadian rhythm with staying awake during the day and sleeping when it's dark. Naps may boost alertness during the day, but can also throw off your sleep at night. To avoid this, nap only in the early afternoon and for a short time, meaning no more than 20 minutes. Also, while there is no strong evidence for this, warm milk and chamomile tea have been associated with chemicals that may help sleep. Strong sleep routine involves maintaining a consistent schedule even on the weekends. This means going to bed and waking up at similar times every day. Set a bedtime that will allow for at least 7 hours of sleep. While it's tempting to skip sleep in order to work, study, or socialize, sleep should be your priority, as it does impact your mood, mental, and physical health. Avoid working on your bed because you want to associate your bed with a feeling of sleepiness rather than wakefulness. Practice relaxation techniques to wind down. This can include light stretching, playing soft music, or meditating. And finally, limit electronic use 30 to 60 minutes before sleep, since they can stimulate your brain. Stress can make it difficult to fall and stay asleep. Relaxation exercises can facilitate sleep. They can help lower heart rate, slow and deepen breathing, and reduce muscle tension resulting from stress. Taking slow, deep breaths is one of the easiest ways to engage your body's natural relaxation response. Take slow, deep breaths in through your nose, hold for a couple seconds, and breathe out through your mouth. Visualization exercises rely on mental images to create a sense of well-being. You can visualize yourself in a peaceful place such as the beach. Another meditation technique involves bringing attention to different parts of the body while you are taking deep breaths. This can help bring a relaxing sensation to that part of the body. Progressive muscle relaxation involves tensing and relaxing various key muscles one by one. Start by tensing your feet for 10 seconds and relax for 10 seconds. Next, move up to your legs, your hips, abdomen, back, hands, arms, shoulders, and muscles of your face. Before bedtime, it is important to avoid electronics due to the emitted blue light, which can hinder the natural production of melatonin and increase alertness. Turning your phone on night mode or using blue light glasses can help reduce blue light exposure. Avoid vigorous activity or exercise at least 1 hour before bedtime. Avoid eating 2 to 3 hours before bed to allow your body plenty of time to digest. Light snacks are okay. Alcohol may make it easier to fall asleep, but it will disrupt sleep later in the night. Avoid nicotine and caffeine in the late afternoon or evening, as both are stimulants that can interfere with sleep. The effects of caffeine can last up to 8 hours. And finally, reduce fluid intake before sleeping to limit bathroom runs.
All right, so now we'll talk about over-the-counter sleep aids. The first category is sedating antihistamines.
We have diphenhydramine, also known as Benadryl, and doxylamine succinate. Diphenhydramine is FDA-approved antihistamine, and it has sedative effects. However, there's insufficient data to support its use as a sleep aid. Some studies show limited sleep improvement with 50 milligram dose, but also show psychomotor impairments and sleepiness the next day. For doxylamine succinate, it's a first-generation antihistamine. It also has sedative effects. It is used for short-term insomnia treatment, so it helps with falling and staying asleep. But if you don't see any improvement within 2 weeks of taking this med, it should be stopped. So melatonin is another over-the-counter sleep aid that people use. It's a natural hormone produced by the pineal gland. It helps regulate the circadian rhythm, which is the normal sleep-wake cycle. Melatonin supplements have shown a mild benefit towards treating jet lag and might also help people fall asleep faster. They can also be beneficial in improving sleep in people who have circadian rhythm sleep disorders, such as delayed sleep-wake phase disorder or shift work disorder, because in these disorders, melatonin levels are decreased, so melatonin supplements can help people sleep faster in these disorders. However, there is no FDA indication towards melatonin helping people fall asleep. It is only approved as a dietary supplement. So Valerian is another over-the-counter sleep aid. It's obtained from Valerian root, and there is insufficient efficacy data in favor of these plant-derived sleep aids in regards to helping people sleep. And the composition of these supplements also vary based on different manufacturers because these aren't as strictly regulated by the FDA. The effects on pregnancy, lactation, and infants is also unknown with these meds, and they can also interact with your other sleep medications, causing increased grogginess the following day. So this table shows the potential side effects and medication interactions of these over-the-counter meds. Most of these meds have the same side effects such as dizziness, excessive daytime sleepiness, the following day, GI effects like nausea, upset stomach, and some specific ones such as mucus in the nose and throat for doxylamine, bedwetting for melatonin, epigastric pain for diphenhydramine, and dry mouth for valerian. They also have interactions with medications, such as blood thinners and antiepileptic when it comes to melatonin, acetaminophen with diphenhydramine, aspirin and acetaminophen with doxylamine, and medications like buprenorphine, sodium oxybate with valerian. Most of these medications, they contain antihistamines for their sedative effects. And tolerance to sedative effects of antihistamines is time dependent. So the longer one takes them, the quicker the sedation becomes ineffective. There's also effects such as the hangover effect, which you have a groggy and foggy headed feeling the following day, and obviously potential interaction with other medications. There are also some herbal remedies available, like chamomile tea with mild sedative effects, but it can be allergic to people who are allergic to plant pollen. Kava, which may have some effect treating insomnia caused by stress, but it can also cause liver damage. And tryptophan is an amino acid, and some studies have shown sleep benefits with tryptophan. Now if we move on to pharmacologic treatment. So the first category is sedative hypnotics. Benzodiazepines. They can cause both physical and psychological dependence. The symptoms and signs of physical withdrawal include rebound insomnia and anxiety once you're off these meds. This can be experienced 3 to 4 weeks following discontinuation of therapy. Tolerance can also be developed due to continued use and can reduce the overall quality of sleep. The hangover effect mentioned before is also one of the adverse effects of these meds. They are approved for short-term treatment of insomnia, such as estalzalam, flurazepam, temazepam, and trazolam. Another type of sedative hypnotics are non-benzodiazepine drugs. Non-benzodiazepine sedative hypnotics have a lower risk of dependence, and these meds include xalapam, zolpidem, which is also known as Ambien, and azopicolone. FDA lowered the dose of these meds due to morning grogginess in mostly women. And some of the adverse effects include tolerance, rebound insomnia, headache, dizziness, nausea, difficulty swallowing, breathing, and worsening depression, which can also lead to suicidal thoughts. Lastly, we have the melatonin receptor agonist hypnotics, known as Ramelteon or Rosarem. This is the newest type of sleep medication. Its mechanism action mimics melatonin, which is a sleep regulation hormone. It has a low risk of physical dependency, and some adverse effects include dizziness, which is the most common one. It can worsen depression and is contraindicated in severe liver damage. It only helps with falling asleep. There's no efficacy towards this medication helping stay asleep. Here are our references. I hope you enjoyed and learned from our presentation, and thank you so much for your time and attention.